The views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Welcome to Public Health America, a 30-minute program on BronxNet where we talk with national experts to promote health and social justice. I'm your host, Dr. William Latimer. We begin by focusing on a current health topic from the COVID pandemic to cardiovascular disease. Our goal is to provide you with not only the best science, but practical tips to live a healthier life. On Public Health America, we also celebrate what studies have long documented, namely the unparalleled value of a college education by setting the stage to pursue a career of your choice, increase lifetime earnings and opportunity, and champion the ability to engage in civil debate. But for many, finding a path to college is neither clear nor certain. What if you're a high school student with supportive parents, but feel daunted by the prospect of being the first in your family to attend college? What if you're a single mother or father and want to attend college but have no childcare? On Public Health America, our expert will also talk about decisions they made and support they received that helped them beat the odds. By sharing one or two life lessons, their stories may provide you with the inspiration and method to realize your dreams. This is Public Health America. Welcome to Public Health America. I'm your host, Dr. William Latimer. I'm very pleased to have with us today Dr. Olga Acosta Price, Director of the Center for Health and Healthcare at George Washington University Milken Institute for the School of Public Health and Associate Professor in the Department of Prevention and Community Health. Welcome, Olga.
Thank you for having me.
Pleasure. So I know you've been doing a lot of work in children's mental health in school-based settings and other community-based agencies. Even I know that there's been an explosion of mental health type of issues pre and during COVID. So why don't you set the table for us and let us know where are things at and where do we need to be?
Absolutely. So we do know that children's mental health issues have been a concern and unfortunately a growing concern over the last year and a half. We already knew that estimates shown that at least 1 in 5 children had a mental health issue that really kind of prevented them from really maximizing kind of their health and well-being, and the pandemic and the stressors and adversities that caused in families and neighborhoods and the racial violence that we also experienced as a country really exacerbated what these conditions and the impact of those stressors on children and families. And so we don't have, as you know, probably all the data to be able to say with definitively what the results of that have been, but we do know anecdotally, and we do know from our own work in communities that it's significant. And the discourse around children's mental health, I think, if there's any silver lining, is that it is much more prevalent. We are talking about children's mental health. We're talking about intervention, prevention, and doing so kind of wherever children are.
So let's talk about prevalence. You alluded to it a couple of times. What are the mental health disorders that are most prevalent? And is there a variation by age?
There are differences in when particular mental health disorders may first arise or when you might first see early symptoms. And so, but I think folks often are surprised to know that anxiety disorders and depressive disorders actually may have the etiology for some children much earlier, like in elementary school and middle school, whereas it's hard for us to sometimes think about young kids, really children experiencing kind of significant mental health problems that early. We do know, though, that in young adulthood is when other kinds of conditions and disorders and more serious mental illnesses might also emerge. And so there are those periods where, and the transition periods where we may see a higher prevalence of some disorders, but probably I would say that depressive disorders and anxiety disorders and some behavioral disorders are more common than, for example, some of the rare kind of psychiatric disorders that we might, that we know about.
So I personally think this is a difficult question. So if it's the wrong one, you'll tell me and we'll move on. I was recently hosting a roundtable with some incredibly poised young adults from the Bronx, and they told incredibly poignant stories like being homeless with their mom, living in a car, doing their public school work on a smartphone because that was the only way they could do it. And this was a young adult that survived and made it beat the odds. But when I think about that level of stress, which is just so extraordinary, how would you not be depressed? How would you not be anxious? And what I'm not able to tweeze apart is the difference between mental health issues and just normal responses to stress. Is that a fair question?
Absolutely a fair question. And it's something we think about a lot in our center and in our work. We are as much interested just as much in ways that we can reduce the kind of impact and stress that someone may experience. That's still important, but it's really important for us to take account of the kinds of conditions, of the factors in the environment that we know can that create that stress, that are the underlying issues. The pandemic has brought to light so many of the disparities that we see, that we've seen before, but it has only kind of made them much more prominent. Housing instability, food insecurity, employment, unemployment, and economic insecurity, and all of that. You're right. Anyone would experience those kinds of significant challenges and adversities and stressors and traumas. There is a normative reaction that one can expect. It doesn't make that reaction or the symptoms any less significant or severe, and we still want to be able to help individuals and families cope with those experiences. At the same time, that one of the things we're really interested in, what are the ways that we can collectively think about addressing and mitigating the impact of these social determinants, or as we like to call them, the social influencers of health and education.
Sure. So that's very helpful. So it seems to me that, and I think this is consistent with your work, so I'd very much like your views on this, that school systems, and probably K through 12 public particularly, but all school systems generally, are a realm in which providing appropriate mental health care is a critical catchment area to address these sorts of issues. Am I on the right track? If so, what do we need to do? And if there are other arenas that matter, please let us know what they are.
Yes. We believe, and I believe very strongly, and it's why I've spent my career really thinking about this and trying to do research and to collaborate with partners in different parts of the country, that schools are an essential partner, an essential setting for any young person. If we create interventions and think about, from a public health perspective, that don't involve or think about the education system and what role the education system plays, I think it really undermines the success of that intervention, because it is not just a setting where children and young people spend an inordinate amount of time, but I think more importantly, it is a very powerful influence on young people. We know that schools and the individuals in schools, second only to families, really are have such influence on the development of young people, not just their learning, but their social and emotional development, learning coping skills, all of the conflict resolution and socialization. These are all really critical just for development, for growth and And so schools play and the people within them, and the adults and the young people play such an important role. So we've spent our time at the center really thinking about not just the programs and curricula that are important and can be delivered within schools effectively, but also the conditions in schools that we need to pay attention to that create the kind of safe, healthy, engaging kinds of environments that our young people have missed over the last year and a half. And many talk about how they miss being in school. And I think because for many children, and particularly those where the resources in their neighborhoods don't offer a lot of different kinds of opportunities, schools really are not just the learning space, they are the social spaces, they are the athletic spaces, they are the spaces for voting, they represent a real hub of communities. And so they are an essential player, I think, in a lot of our public health interventions.
Sure. So we have just a little bit of time left. Let me ask this. I mean, there's so much to do, and resource allocation is a never-ending debate and challenge with the folks that oversee the budgets.
Mm-hmm.
How do we move the needle to, I'm thinking of urban city schools, public mostly, that are ensuring that schools are safe. Mm-hmm. And by that, I mean both in terms of COVID and just in terms of behavioral safety. But then you have these overwhelming or at least very intensive mental health needs. At what level do we need to advocate so that resources are employed judiciously to serve the students best?
So I think it is difficult, and this is a struggle that I think those within education and those partners with education have struggled with, is that there are a lot of demands and a lot of competing priorities, all of which really individually feel incredibly important. And yet there are a lot of advocates and a lot of us that would say, and educators along with us, that having an individual, and that's a child or the adult working with them, that isn't well, that isn't feeling mentally able to engage effectively in learning or teaching, that you can't get to those outcomes that we want in schools and what schools were really, put in place to do. So I think we have had to do less of that advocating and arguing and sort of fighting for limited resources. I think now we're really at the point where we're talking about how do we best integrate these resources, how do we share responsibility for the well-being of our whole children, of our students, and of the adults in the building, and the leaders. I mean, they all play an essential role, and families too. I think that we often think about those entities as ones where there are these other professionals that really call the shots, but families play a really critical role. We know that schools where families are very engaged in their students' education are more successful schools, and really are able to leverage the resources that parents also bring. So it's really often about kind of collaborating and really trying to think about partnerships, school, community, family partnerships. And that's a lot of what we think about.
Makes a lot of sense. Thanks so much. We're going to take a quick break. When we return, Dr. Acosta Price will tell us a little bit about her personal journey and life story that allowed her through college and post-grad to have this wonderful career that has enabled her to do this great work. We'll be back in a moment with Public Health America. Take care. Welcome back to Public Health America. I'm your host, Dr. William Latimer. I'm so pleased to have Dr. Olga Acosta Price here with us from George Washington University. So, Olga, in this part of the segment, I always start with the same question. Where were you born? And tell us a little bit about your formative experiences.
I was born in a small rural town in upstate New York called Ellenville, New York. I am the first child of Dominican parents who were immigrants to the United States, and who really made their way from Washington Heights in New York City, where many Dominicans are, to this really remote kind of rural town where we were the first Dominicans. And I grew up. I don't think I realized how formative it really was and has been to the decisions I've made in my life. My dad, as many immigrants have, part of his story is that he really wanted to come to the United States to offer his, new family. We were born in the United States, but he came really with the intent of forming a family and having a family here so that we could take advantage of education. And I was able to do that because my parents, and particularly my dad, who did pass away about a year ago, his he was a perpetual learner. He was always a student, and I think he really passed that on to my siblings and I. It wasn't easy growing up as I think we did experience discrimination and racism. But there also were some protective things living in a small place where a lot of people knew you, and there was something very protective about that. And in particular, school meant a lot to me. I mean, the work that I do now about the power and the influence of schools really came from the fact that schools were the hub of our town. There was really very little in our town besides school, and school was where you did your socializing and where you had plays and where you went, you did your athletics and you voted so it was very influential. And I'll say that both, again, in ways that were challenging, but in ways that were also really important and growth promoting. I did have a counselor who, when he learned that my goal was to go to Vassar College, as I had fallen in love with this little college in Poughkeepsie, New York, and I thought it was ideal. I really, he said to me, that he didn't think I would make it. I wouldn't get in, and I shouldn't try, because my SATs were just average. And even though I was a really hard working student, and I, did well, there was nothing that was so exceptional about me. And so I almost didn't apply at all, even though that was my dream to go there. And really having not just my family as like an incredible support, but we were of a culture where this is an individual who you defer to because they didn't know the system. And so they thought, well, if the counselor says you shouldn't apply, then maybe you shouldn't apply. But I had other friends and families, sort of family friends, who said, it can't hurt. It's a common application. Just do it. And I'm really glad I listened, because I got in, and that's where I ended up going to college. And it really opened up incredible doors for me.
Yeah, Olga, that is such a powerful story on so many levels. So, I don't want to offend any school counselors out there, because there are one or two good ones, but certainly a take-home message of your incredible story is, if a counselor tells you you can't do something, don't listen. And I will go on record to say that is my view. Obviously, Vassar's a great college. And the fact that you made it in doesn't surprise me one nickel. The other comment I have to make based on your story is, isn't it just sort of bittersweet, tragic, and wonderful that in a small town in upstate New York, which is not that different from where I grew up, in a small town in upstate New York, that you can find, wonderful mentors and people that will take good care of you, but you also find particularly if you're the only brown person
Mhm.
or only black person
Mhm.
in the neighborhood, that there is inevitable uh, uh, outcome of difference,
Mhm.
otherwise known as racism.
Right.
Um, so, talk a little bit about your experience at Vassar,
Mhm.
and were there some critical moments that helped you there?
Absolutely. And I will say, I, in my career now, work with counselors, and you're absolutely right. I mean, there are some incredible, dedicated counselors. But I don't know that they often realize how powerful their words and guidance are, and how much it would have really shaped the course of my life had I really listened. And so, Vassar is a beautiful college, and it's rigorous, and it's challenging, and all the things you'd want a school to be. But it was difficult for me. I'm a very poor family, immigrant, first one to go to college. I was lost, and it was hard. It was hard to be with very worldly people, from international students, and people very wealthy backgrounds, and not that everybody was like that, absolutely not. But it felt like I was out of place, and so again, finding my tribe, finding my village of people, finding those professors who saw something in me, and really spending time with them, and letting them kind of shape my experience was everything. And I will say, so I'm happy to say I graduated from Vassar with a major in psychology. But one of the lessons there, and I did experience some discrimination. People say very offensive things to me, things like that, just ignorance. But I graduated and wanted to go to graduate school, and I applied to like 13 graduate programs, thinking that was my only plan. Plan A: go to graduate school in clinical psychology. And I got into none of them. And I wasn't prepared for that. And I thought, I worked so hard. I'm an A student. I'm at Vassar. I mean, I have kicked butt. And, I didn't, I, again, seeking my mentors, I did work study, and I went to the work study office, and I was in tears. I didn't know what to do. And they said, well, there's an application for this pre-professional traineeship. Today's the last day. Get it in. Let's see what happens. And, I actually got in, and that was one of the life-changing moments of my life, because I spent a year really mentored by who's still one of my mentors, at the Devereaux Foundation, and did a year of research and
Sure.
really honing my skills. And I reapplied to graduate school, got into 9 graduate schools a year later. So I think it just, I guess one of those lessons being that you, feels devastating to feel like you failed, but sometimes those are opportunities for some other course of action in your life, and just not giving up, and not sort of staying open to other opportunities was something that I really took from that experience. And again, I've just been very blessed with the opportunity to continue to grow and pursue education.
Yeah, this is like, I if I could write a script, this would be it. Only it wouldn't be 1/100th as good as what you're saying. So I think a couple of really important messages here that I want to highlight. One, you finished undergrad at a top-notch, college, and making it there, as a first-generation college student, did
Mhm.
really well. Applied to 13 schools, which, by the way, just to let our audience know, that's very typical.
Mhm.
Didn't get in.
Mhm.
I can't say how many times I've sat with students, and mentors sat with me in the context of failure.
Mhm.
And it's just get back up
Exactly.
and get back in the game, and it's going to work out. Just know what your goal is and stick to it. And that's what you did. And the second message along that trajectory for you, which is also, I think, very important, is a kind of internship experiential learning
Mhm.
moment that you did over that year. It sort of gave you a chance to have additional mentors,
Mhm.
hone your message, hone your thinking, and then you apply to 10 or 13 more schools and get into 9. So the
right.
message for the young people and non-traditional age people out there is you can do it, stick to it, and you're going to face bumps. It's unavoidable. It's unavoidable. So we just got a minute or so left. If you were going to give what's such a lovely story on so many levels.
Thank you.
If you were going to give advice to a young person in the Bronx or a non-traditional age potential student in the Bronx to get them to attend college to sort of move their potential professional careers forward, what would that advice be?
I think that in addition to some of the sort of life lessons that I experienced that I hope will help others, I would say that don't let others' perceptions of you limit your opportunities and your abilities. I'm not one that always had very high self-esteem. I think that came with time. So to say, believe in yourself, I tried to believe in myself, but I didn't have enough experiences to know that I really had what it took. But I relied on people and I surrounded myself with people who also believed in me. And I think that made the difference. And, to not let when others put you in a box and sort of limit what they think you can do because of your pedigree, because of where you come from, because of what language you speak, whatever it is, what you look like, that's their limitation. And I'm grateful that I've had incredible family support and friend support and mentor support that I don't think I could be here without that. So
that's wonderful. I want to thank Dr. Acosta Price. I want to thank our viewers for tuning in. I'm your host, Dr. William Latimer. See you next time here on Public Health America. Take care.